I am Jessie Whittish with Kentucky Youth Advocates. It is so good to see all of you this morning, and so good to hear all of your ideas and suggestions around Thanksgiving food. So just a reminder that we are recording today's forum to share later as a video and as a podcast. So we ask that you stay muted, but we are taking questions and comments via the chat feature. So our panelists may be able to answer those during the forum, or if we don't have an answer, we can follow up with you after the fact. So please do drop those in. And with that, I am going to turn it over to Terry Brooks, who's going to welcome all of you today.
Hey, thanks, Jessie. I kept trying to think, can you integrate leftover Halloween candy into some kind of Thanksgiving food? So I'm still working on that. So as we always do, we want to welcome everybody to our weekly advocacy forum, which, as we mention each week, is possible through our partnership with Aetna, who helps us be able to pull these off. This is, I don't know, number 33, 34. And as we always say, thanks to all of you who are here every Wednesday, and special welcome to those of you who are here for the first time. Two caveats before we get into the topic at hand. We got really, really strong outreach after last week's self-care session. I want to reiterate what we said at that time, which is if the topics at hand that day you feel like are applicable to you internally within an organization for staff or for folks you serve, please reach out to us. We'll connect you with the Bounce Coalition, and they are interested and stand prepared to try to customize that kind of self-care experience for staff and or for clients. So I just wanted to reiterate this. Secondly, this is not in my script today, but I feel almost an ethical obligation to just take a second and let us all pause to remember that this is Veterans Day. To let us remember that the reason we are able to have a robust political season in America, the reason we can speak and disagree, the reason that we can practice the faith beliefs we each desire is because of those sacrifices. And I don't know about you, but if I'm not intentional about pausing today, it's really easy to go past today without taking time to do that. So I just wanted to kind of make sure we've raised everybody's consciousness. And to me, that's a really important thing that we all need to remember today. So the topic at hand today, as you know, is health coverage. We know that the pandemic has only increased awareness of what everybody on this call already knew. The imperative nature of health coverage for families and for caregivers. We know that the pandemic has brought significant changes in how Medicaid services are delivered, especially for kids. Some of those have been really good, great opportunities born out of crisis. And there's also been some fissures and cracks exposed in the system that we have to make sure get addressed. We also know that there is really good news in the sense that the trajectory recently has been that Kentucky has more households and more kids covered than historically, and that then compared to our peers nationally. So that is a bright spot. We also know that the numbers from the pandemic just reminds us of what we already knew, that there is a disproportionate negative impact. There are gaping disparities around health coverage when it comes to families of color, when it comes to families in certain zip codes. And so those kind of disparities are among the things that I'm sure we're going to talk about today. So as in most policy arenas, Health coverage is that good news, bad news equation that we have to balance so carefully. We want to celebrate progress. We want to tackle challenges. And with us today is a flat out all-star panel that we're all going to learn from, and we're all going to be challenged from. And I've said that, and I've been told that's all I can say about the panel, because Mehak Kalra is going to be the formal introducer. So thanks for being here. Thanks for the support of Aetna for making this possible. And Mehak, I'll kick it to you.
Thanks, Terry. And like Terry said, we do have an all-star panelist here today. So one of our panelists is Allison Adams, the Vice President for Public Policy at the Foundation for Healthy Kentucky. We have Deputy Commissioner of Department of Medicaid, Veronica Cecil, joining us as well. We have Kelly Pullen, the Executive Director of Kentucky Sky. And last but not least, Ashley Shoemaker, Director of Outreach and Enrollment at Family Health Centers. So today's conversation, our goal really is to elevate access to care, discuss changes with Medicaid managed care contracts, and this year's open enrollment period and what families could expect. So before we dive into questions, I'm going to let Veronica kind of share what's new with Medicaid managed care.
Thank you, Mehak, and I believe Jesse's going to pull up the slides. And while she does that, Terry, thank you for recognizing our veterans. This is more than just a state holiday. It has a purpose, and I'm certainly grateful for our veterans' service and sacrifice. So thank you. You can go to the next slide. So we put this, I wanted to put this in writing so this could be shared afterward, because it is a lot of information, and don't feel like you have to write everything down. But we are in the middle of open enrollment. It goes to December 15th. It is a passive enrollment, which means that those members who have managed care organizations currently assigned to them, they will continue with those same MCOs on 1/1/21 unless they make some kind of active change to them during this period of time. Because these are different times, we are also permitting not for 90 days after enrollment ends that individuals can change their managed care organization for any reason without cause. We won't even ask why. And part of that too is we were a little late in getting our open enrollment materials out to folks, and we just want to make sure that they feel comfortable with the decisions that they're making during this period of time. And there's a lot going on. So there's two ways that they can do open enrollment, and that's to call and they can talk to somebody who will assist them, or they can go on to Connect and they can make the change directly online if they want to do that. I've added our Medicaid website that has all the open enrollment information. There's a sample letter, there's a guide to choosing a plan, and then there's a side-by-side comparison that shows all of the value-added benefits that each MCO is offering to their Medicaid members. Sometimes the best way to get that is just to Google Kentucky Medicaid open enrollment, and you'll get right there. If you can't, don't want to type all that in. Next slide. We have 6 managed care organizations going into January, and Aetna, Anthem, Humana, Passport by Molina, United Healthcare, and WellCare. Their phone numbers for members to contact are listed right here, as are their websites. They can go on, and if you're not sure they have your provider, you can go on there and check to see if the provider's in network with the managed care organization, and then you can find out a lot more information on each one going there. And then I'm just going to mention the Supporting Kentucky Youth program, the SKY program. I know Kelly's here from Aetna and is going to talk a little bit more about that, but we're very excited about this opportunity. It's the first time we've done this, so it's brand new, but we're moving our foster care and dually committed youth, eligible youth through interstate compact, those in adoption assistance, youth and juvenile justice, and former foster care populations into one managed care organization, and that will be Aetna. We're excited about the opportunities that this will bring for better outcomes for these kids and this population, and that they are getting automatically enrolled. There are a couple I've indicated that can opt out once they're automatically enrolled. But again, I know Kelly's going to touch a little bit more about this program. Next slide. I want to highlight a couple of things that are happening specific to the change in the new contract starting 1/1/21. One is a single preferred drug list. So while up to now we had managed care organizations had their own preferred drug list and fee-for-service had its own, now both fee-for-service and managed care will all have the same preferred drug list. We feel like that consistency is going to be helpful to providers and to our members, especially if they move in and out of different managed care organizations. We are also going to have a single pharmacy benefit manager for our managed care population. So we'll have two, one for fee-for-service and one for managed care. But it's going to be, it's not a carve out, it's what's called a hybrid. So the MCOs will still contract with this pharmacy benefit manager, but what you'll see is a lot of consistency in the policies, in reimbursement, in prior authorization. And again, we feel like this will bring a lot of consistency to our members. Also new this year is a population health management program. We're excited about where this might go to help improve the outcomes of our Medicaid members. Very much focused on management of chronic conditions, just being more thoughtful and intentional about the decisions that we're making and the policies that we're implementing to make sure that we're really, we know where we are in the numbers. We really want to do something to try to change those and improve the health of all Kentuckians. And then I wanted to mention that as part of the value-added benefits, all MCOs have agreed to waive co-payments in 2021. As you probably remember, right now there are no co-payments under the public health emergency, but the good news is that when that goes away, because we hope that at some point it does, because we're all back on a great path towards better health with COVID, that the MCOs will continue to waive the co-payment. So that's helpful to our beneficiaries. Next slide. I did want to talk a little bit about Connect. It was launched, we launched on October 5th, this new platform and portal. And what we're hoping is that it is a more user-friendly platform. It's mobile friendly, so people can use it on their phone. We've gotten great feedback that it really is. You can take a picture of a document and upload it. And so, it really is about ease of use. What we haven't done yet is move to a fully state-based exchange, and that's going to come sometime at the end of 2021. But again, what I hope is that as people are using Connect, that they're finding it easier to navigate. Next slide. So it's made up of all the benefits that are offered through the cabinet. So food, financial assistance, health, premium assistance through the Kentucky Integrated Health Insurance Premium Payment Program. And that's where we will pay your premium if you're on an employer insurance plan, and then child care assistance. So it's a one-stop shop. You go on there, you can complete a pre-screening tool. You can be identified for all the programs that you may qualify for. So it's it's so much better in trying to help folks understand what benefits are out there for them. Next slide, please. This is just looking at the health coverage specifically. So again, all Medicaid is on there, including our time limited coverage under COVID-19, where we've expanded what's called presumptive eligibility. The qualified health plan on the federal exchange are on there, and you can get connector assistance through that. Next slide, please. And then Kentucky Resources, this is in partnership with United Way and community partners across the state. This is going to be a great place for individuals to go and find out what resources are available in their community. It's not statewide yet, but it's rolling out, and we certainly hope that folks will find it, very useful. You can kind of see on the screen, it's got housing assistance, it's got employment assistance, addiction treatment assistance. So it's got a lot of really great resources for folks. Next slide. I went through that pretty fast, so happy to answer any questions anybody may have.
Thank you, Veronica. I think this overview is quite helpful to ground us all as we move ahead. I did see a question in the chat, so before we move forward, I wanted to ask that to you, Veronica. And the question was from Sherry, and she asked, do all the MCOs cover the whole state, or are there some that are regional specific?
Great question. We do require all of our managed care organizations to be statewide. Now they have, it just kind of is fairly typical that they concentrate, they have populations that concentrate based on word of mouth or advertising in the area. But yes, they are required to be statewide, which means they are required to have a statewide provider network. And they are, regardless of where they have membership, they are required to maintain that network.
Thank you. I don't see any other questions in the chat, so I'm just gonna keep rolling. So Kelly, as Veronica shared, the new program called SKY for Vulnerable Youth, as the official MCO managing care for the SKY population, how will the SKY contract be implemented? Can you share more about the SKY contract?
Sure, absolutely. Mahek, I did see though, Sherry Martin had her hand up. I'm not sure if Sherry had a question or if she was, okay. Didn't want to skip over her. Well, good morning. I'm Kelly Pullen. I'm the Executive Director for the SKY program at Aetna Better Health of Kentucky. In regards to implementation, I'll touch on the populations first. I know Veronica mentioned those as well. We're really proud to serve children that are impacted by Kentucky's out-of-home care system. And we will be serving children in foster care, children who are adopted from foster care, our foster care alumni, children who are duly committed to DCBS and DJJ, which is the Department for Community-Based Services and the Department for Juvenile Justice. And we will be serving youth who are involved in the Department of Juvenile Justice who are Medicaid eligible. And here at Aetna, we're really here to provide direct support to our enrollees, our foster parents, our adoptive parents, our caregivers, DCBS and DJJ workers, and our SKY program is really committed at improving the outcomes for children and families. We know that system-involved youth are really among the most vulnerable individuals in our society. They face really unique challenges that require an unwavering commitment, collaboration, and compassion. And Kentucky's kids are often at the intersection of multiple public systems that include behavioral health, child welfare, education, juvenile justice, and primary care. And we know that behavioral health is really one of the single most unmet needs among this population, which includes the enrollees that are in SKY. And so this intense behavioral health need combined with physical health needs and oral health issues that have really resulted often from a lack of consistent health care results in this population that really does require a high-touch approach and requires easy access to comprehensive services to meet these unmet needs. And so that high touch approach and that focus on easy access to services really is our foundation of the SKY model that's being implemented in Kentucky. And SKY is really implemented through collaborative and collective partnerships with the system stakeholders to achieve shared goals. And some of those shared goals are to reduce the number of children that are being removed due to neglect, to return children from long-term out-of-home placements to their families, specifically youth who are placed out of state or youth that are in residential, and to ensure that our youth have permanency plans that include lifelong connections with biological relatives or informal support, and that each child that we serve have a life domain care plan that has community-based resources to meet their needs. And at Aetna, really our role in implementation is to be a convener, a facilitator, a catalyst, that's here to provide support to the cabinet. We're here to provide support to our provider system to really truly transform this system and practice and equip our stakeholders for sustainable change. And in implementation, we really are catalyzing around these shared goals. We're convening, and Aetna is facilitating. And so some examples of catalyzing for implementation, we are helping to talk about how we practice as a system and how we teach others. And that includes partnerships and collaborations for us to have a really robust integrated care team model. We're implementing Family First Services Act tenets that include family finding, which is a global model to help youth find natural support networks. And we know that that's one of the single most important things for our youth is to have a support network. So we're really convening and partnering with the Department for Community-Based Services, with the Department for Medicaid and DJJ to implement some of these tenets and these models. We're also partnering with DBHCID and other community stakeholders to implement high fidelity wraparound. We know that there is a lack of capacity in our system for that, and Aetna's committed to not only training our own team members and certifying them in high fidelity wraparound, but to help train and certify others in the community to provide that resource. Throughout implementation, we're also convening, and our health plan teams really are the foundation for that, and will really be around to provide supports to the system, to our stakeholders, and most importantly, to our children and families in Kentucky. And each team at our health plan has a really significant role. Our member services team is going to be here to provide after-hours crisis support to the system. They'll be our traditional system navigators for families and children in Kentucky. Our system is going to be instrumental, which is utilization management, and evaluating the services that children and families are receiving in Kentucky, and really ensuring that we're providing the right service to the right children at the right time and at the right place, and that those services are resulting in positive, sustainable outcomes for our kids in Kentucky. And our quality management department is instrumental in ensuring, right, that we're tracking those outcomes and that we're rewarding those services that are working for our kids. And finally, I would be remiss if I don't talk about our care management team, and I'll get into that a little bit more in questions, but this model is really founded on providing enhanced care coordination to these members, again, because there are some significant unmet needs. So we're excited to be rolling out really a new innovative model for this population.
Thanks, Kelly. I think that's helpful, especially as you all are officially about to launch this program. It's great to hear the various phases of implementation and working with likely and unlikely partners, providing this vulnerable population with easy access to services, whether they're wraparound or just your traditional services that are needed. And then also maintaining and managing like what data is showing as well. So I appreciate the thoughtfulness and the approach that you all are taking and sharing that with us today. And so now I'm going to turn it over to Ashley to really talk about, as on the ground expert who sees patients and families kind of struggling with health insurance and accessing care, to share what is your role as a connector? We heard Veronica share that Connect has launched, relaunched, I should say, for families as a resource to not only apply for benefits, but to get assistance from connectors themselves. So, Ashley?
Thanks. And, like Veronica said, Connect is back, and that means that connectors are back too. We actually haven't gone anywhere. We've been called a few different names over the years, application assisters or navigators, but I'm really excited to be able to claim that connector title again. Connectors are people in the community who have gone through specific state and federal training to help people enroll in health insurance, whether that is Medicaid or the qualified health plans, which are still on healthcare.gov for this year. And we're also a resource in the community that can help refer people to other resources and other services that they need. We've been seeing a lot of people, a lot of families recently who have lost jobs, or they have, not been able to work because they're, they have to help their kids with NTI, or they have a compromised family member in their household. So we're seeing a lot of people that have lost employer insurance. And this is the first time that they've applied for public benefits. So helping them work through that application process and kind of destigmatize Medicaid and public benefits is a really important part of our job right now. Likewise, people come to us and they know that we are a resource in the community, and so they're not just asking for help with Medicaid or with healthcare.gov application, but they want to know where to go to apply for SNAP benefits or for housing assistance or these other benefits. So the Connect Resources page is going to be a really helpful tool going forward as that continues to roll out, to help connect people to other resources as well. We've been very busy trying to get the word out about open enrollment. We have some overlapping open enrollments right now with Medicaid, which was November 2nd through December 15th. And also the healthcare.gov open enrollment is November 1st through December 15th. So regardless of what someone qualifies for, we can help them with those applications. We've also been granted permission to do the COVID-19 temporary Medicaid applications for people who need coverage right away. So we are working hard to try to get that word out. I know the Kentucky Health Benefit Exchange has been doing a social media campaign and radio ads, and Family Health Centers has been doing some targeted outreach to our uninsured patients to let them know that there is help available. There is still affordable health insurance options for families.
Thank you, Ashley. I think we all really, truly appreciate the vital role that connectors play in the community. So thank you for all that you have done and continue to do, especially during this difficult time with the pandemic. So I appreciate it.
Hey, Mahek, if I could just thank you, Ashley, and for the work that you do, and you provide such a valuable service. I do want to make sure and clarify to make sure people understand Medicaid enrollment is year-round. So open enrollment for Medicaid means you can change your managed care organization, which is different than healthcare.gov, which if you don't enroll during the open enrollment period for qualified health plans, then you have to have either a qualifying event or you have to wait till next year. So it's so, thank you for pointing that out, Ashley. It's very confusing for people to understand that that's different. But yeah, Medicaid enrollment is year-round.
Thank you for clarifying. I know when we talk about health insurance, it could get a little wonky and confusing. So I appreciate every additional feedback. So interject all that you want because you are the Medicaid guru here. So now we're going to transition to Allison, and we cannot talk about Medicaid without talking about Medicaid policy and some budget investments that are needed, especially knowing that the legislative session is right around the corner. So Allison, I'm just going to turn it over to you for a few minutes.
All right, thank you, and good morning to everyone. I just want to give a brief introduction. I'm brand new to the foundation, and I'm excited about my role in as a public health policy person for the foundation, and I'm looking forward to working with this group and getting to know you all even more than I feel like I do already being on Zoom with you. So when we talk about the public policy of Medicaid, all the things that we hear about are, need funding. And so as we move into the 2021 session, we know that it's going to be a very difficult one for legislators working together to build Kentucky's basically biggest policy document. And I know it's no news to you, but when we talk about where we really need to see the focus on policy, we need to pay close attention to the budget, because where we put money and for what programs really shows Kentucky's priorities. And so as advocates, sometimes we tend to focus individual on regulations or some bills or just individual policies that are being proposed, but we have to really pay a lot of attention to where the money's flowing, because that's what's needed to support all these quality programs moving forward. So I think as we move to the beginning of the legislative session, we need to be very thoughtful and intentional about paying attention to where that money is flowing, so that we can advocate to our legislators to lift up the priority of Kentucky's health by supporting those programs inside the budget. And Terry actually said a couple of things that I wanted to say, but it's because it's no news, but COVID has really shed more public light on the gap of healthcare. And so it's given us a sense of urgency and an opportunity, in my opinion, to prioritize policies to close those healthcare gaps. So when we talk about being intentional with our legislators, individuals, as their constituents advocating for the most vulnerable of Kentuckians, we need to make sure that we are capitalizing on the very public focus that the COVID pandemic has shed on the health disparities of our people. So I think when I'm looking at the policies that we should be making sure that there's funding to, we've already heard what the connectors, the SKY program, and expanding Medicaid benefits, enhancing them. I really think that we should be focusing on making sure that there's enough funding for substance use treatment and recovery. And I have to give kudos to Veronica and the team. Proposing to extend coverage for incarcerated individuals and making sure that there's no gap from moving from out of incarceration into society, so they continue those treatment and recovery services. And so good things are happening in Medicaid. We just got to make sure that the funding is allocated to the right places. Mental health and I think that transitional services, we have to make sure that we have enough connectors. Like Ashley, we got to make sure that there's enough connectors to cover the need, and that takes funding. And we can't just give lip service to connectors. We got to make sure that they're not overwhelmed and they're able to take care of the needs of the beneficiaries. Because I think as we're moving Kentuckians expanding their opportunities to gain, we want to make sure that they maintain that coverage and really use the coverage to the best of their health advantage. And what I mean by that is making sure that there's enough funding to improve the beneficiaries' access to providers across the Commonwealth. And, and also what policies are prohibiting intentional or otherwise, preventing that access to, as we increase Medicaid beneficiaries, we got to make sure that there's providers out there who are accepting new Medicaid patients and making sure that they're not just covered, but they also have that access. And then I think when, if we're intentional about paying attention to that funding source, following the priorities, that we should also make sure that and I know Medicaid is working on some things, but really working on, identifying community health workers as a qualified provider. I think that they can be essential to keeping our beneficiaries on track with health screenings and routine examinations. And Kentucky's falling behind on our immunization rates, children and otherwise, and knowing that the COVID-19 immunization is on the cusp, is on the horizon, and there's some distrust. We need to make sure that we're intentional about educating our connectors, community health workers, and our providers to be advocates of the prevention efforts that are moving forward. And I think that working with Medicaid as advocates, we can really have an intentional outcome if we can work together and be advocating for the same result, which we all know is improving the health of Kentuckians. Public or private coverage, it doesn't matter what. We know that having insurance, having health insurance, or having health coverage is one of the basic needs Kentuckians need to achieve health. So with that, I think that, just to wrap up, making sure as advocates we're following the budget and the money that's being put into Medicaid and for what programs, and making sure that we're advocating for enough funding, not just adequate funding, but a robust funding source so we can start, really having quality results in Kentucky. And then making sure that we have primary care providers that are willing to accept new Medicaid patients so that we can have access. And then being very intentional with our connectors and community health workers to keep our beneficiaries on track for routine examinations and proper utilization of the coverage.
Thanks, Allison. And I think you brought up some really critical and important points. Like, first, having coverage is a step, but actually accessing services and removing those barriers for families is truly critical. So thank you for highlighting and sharing that. So now I'm going to open it up and ask you all questions that anyone could jump in at any time. So one of the questions that I have for you all is, we noticed that COVID has shed some light, some positive and some negative. So what are some lessons that we've learned through this pandemic that could better serve kids and families when they're accessing care?
I'm happy to go first on that. I definitely, we did greatly expand telehealth. Just the way to access that for people. We had a very antiquated program and a policy around that, and so we have allowed to implement some great flexibilities as a result of this that Medicaid is looking at continuing past the public health emergency. But with that, I think we also have to recognize that telehealth doesn't get us everywhere we need to be. It's a great first step, but it doesn't deliver a vaccination. So I think we have to figure out how do we take that expansion and those flexibilities and incorporate it into those things that are absolutely needed. We were just talking about this a couple of days ago, where perhaps the practitioner could do a telehealth visit and then schedule a drive-through vaccination. So those are the things we need to explore, and we need providers to help us figure out what are those interventions and innovations that can help us deliver that service a little bit differently.
And this is Allison, and also in that same vein, making sure that, I think that making sure that telehealth services are available, but also just, I'm a very upstream type of policy gal, but when you think about, if we're going to expand telehealth, we got to make sure that the broad bandwidth is available all across Kentucky, and so that we have that, that ease of access, because there's nothing more frustrating than to be waiting for your doctor and then watching the little spinning thing, waiting to connect with your doctor. And, we know we're in a instant gratification world, and, if they're logging on, we want to make sure that they have that quick access so they stay on and stay invested in their telehealth appointment, because it's not the telehealth issue, it's the broadband issue. And sometimes Medicaid or, it's not their fault. It's not the program's fault. It's the connection fault. So, I think we need to be intentional about advocating for the upstream policies that help with ease of healthcare access as well.
It's all interconnected. Ashley or Kelly, do you have anything else to add in?
I was going to add in, I think one of the lessons learned from the managed care side of the house is really to focus on that persistent outreach. When COVID hit, we really increased our focus on that. And if somebody was exposed, right, having our care management department reach out to those individuals frequently to help ease, again, access to service, to do discharge planning, to follow up with our members and ensure that their care needs are being met. And that's one of the things that I know this is pertaining to everybody, but in Sky that really excites me because we do have a more intensive and robust care coordination model where we have a lesser ratio for those youth. And we're able to meet with them multiple times in a week and provide really more intense care coordination services to get them the access that they need and to remove some of those barriers. And I really think that we saw some of those tenets being offered on the traditional side of the house, right, to all of our members that we have. And so I think just maintaining that focus where we know we need to have persistent outreach and we need to link these individuals to the services that they need and remove any barriers that they may have, whether that's transportation or other community-based resources as well.
Yeah, and I would just echo what others have said with, you know, connectors. People go to see connectors because they want that in-person assistance. They want that personal touch. And so it's been a challenge to figure out how to help people and how to provide that personal touch when we can't be in the same room necessarily. So, you know, we've gotten creative with doing Zoom appointments with people and, you know, trying to make sure that they know that even if we can't be in person, that, you know, I am still your connector. You can still come to me with any issues. Yeah, so the leveraging telehealth and those remote programs that we have to make things work smoothly has been really critical to the success and how we've been able to get people enrolled.
Thank you for that. Before I move on to my next question, I saw a question from one of our advocates that said, could panelists share more about the temporary COVID Medicaid?
Sure, I'm happy to do that. We've always had presumptive eligibility in Medicaid, although it's been very limited. You had to either be designated that by a hospital or it was just for the pregnant population or some children. But now, right now, under COVID, anybody who does not have coverage for physician, hospital, or pharmacy already have healthcare coverage can apply to this emergency Medicaid. And and I don't want to call it emergency Medicaid, it's this temporary Medicaid. And it covers, you get all the benefits of Medicaid while you're on it. And you can get up to 2 periods. And that means that you get the month of your coverage that you apply, and then you get 2 months beyond that. So it could be a total of 3 months for 1 period, which means a total of 6 months for 2 periods. And those 2 periods are within a calendar year. So we're coming up on the end of 2020. If somebody is in temporary Medicaid, presumptive eligibility, then they'll automatically get renewed for their very first period under 2021. So they get that new 3-month period, and then they can, if the public health emergency is extended, I should say, because I believe it ends on January 23rd. So, you know, as long as the public health emergency is in place, we can continue to cover people through this mechanism.
Thank you for that, Veronica.
Yeah, and let me say, we really encourage folks, though, to go ahead and apply for regular Medicaid. We encourage people to do that, you know, because then you're not going to be caught in this temporary state. And you know, it's I think it's a better long-term continuity of care for you.
Certainly. Thank you. This was elevated earlier when we were discussing, and I just wanted to touch on, we know that there's racial disparities in coverage and in the state systems that serve kids and families. So I would like to hear from each of you, what are you planning on doing within your role or as an organization to address those disparities?
I'm happy to go first. I have to say, I am thrilled because Governor Beshear and Secretary Eric Freelander, who's the Secretary of the Cabinet for Health and Family Services, and our Medicaid Commissioner, Lisa Lee, all share a common vision or concern about the disparities that we know exist. And that has been a major conversation, a regular conversation with the whole team that the Secretary pulls together twice a week to see in each of our respective programs, you know, what is it that we can do to identify and then to address it. The governor has created a new, and I want to get the name right. It is the Health Disparity and Equity Technical Advisory Committee, and his intent is he's created that by executive order, and his intent is to propose legislation, hoping that legislation gets proposed that actually creates that in statute, attaches it to the Medicaid Advisory Council, so that there is a group that is focused on this issue and can help, you know, bring experts together that can inform Medicaid, but really the health of the overall health of people. You know, what can we do to try to help address that? So we're trying to create that culture within the cabinet. The secretary, we're doing, he's brought on folks that have an expertise in equity, and we are, each department is, again, you know, looking at ourselves and seeing what is it that we can do both for our staff, because this isn't something that just happens outside of our employment. We have to make sure that we're also creating and identifying and addressing that kind of those same issues within our own department. So I appreciate that question because it is on our minds constantly, and we would love to have input from folks that are do work with marginalized populations. There's somebody with lived experience that will be on that new committee, which I think is critical to understanding really what's going on and what can we do to address it.
I'll go next. At Aetna, for our SKY program, we are embedding our SKY enrollees in our population health management program that we have. Within that, there is a really strong equity focus, and in particular for our SKY members, because we know there's a disproportionate number, right, of youth who are removed from their parents and involved in the system. And so within our equity focus, we're really looking at overcoming barriers, right, that limit the ability of these populations to receive services. Looking at eliminating interpersonal and institutional biases, right, that may prevent them from obtaining services. and really helping to improve timely access to care. And so some of our strategies that we have through our health plan teams are to align with best practice for this population. We want to keep more children with their families instead of them coming into the system. And our strategy to do that is really to partner with DCBS, DJJ, and the Department for Behavioral Health to expand the use of family preservation services. And again, Aetna has some invaluable resources to be able to offer the system by way of Family Finding and HERO. We have both of the model authors and experts that are going to be providing training and coaching to system staff and also provide coaching to provider agencies. We're going to be collaborating with the department to help to keep foster youth in their local community and to maintain connections to their cultures, helping to analyze data, right, to target better personalized recruitment efforts. We're going to be sure that we're preparing our youth for aging out. SKY is a program that will be able to serve our foster care alumni up through the age of 26. And so we really want to start to prepare for that transition early and then continue to provide these wraparound services and supports to ensure that they have transition plans to set them up for success when they leave the system. And finally, we really want to link our youth to the services that are going to impact them and impact their ability to stay within their community. And so again, we've got a really innovative care management structure where we're providing face-to-face services to these youth, and we're having this high-touch approach with our members. And so part of that is to ensure that our care management team is incorporating community-based resources and preparing our youth to be able to access services and stay within their community.
Thank you.
I'll just real quickly, because I know you might have a couple of more questions and time is running, but the foundation is very similar to others, is that we are building an intentional, I'm going to call it an intentional capacity to make sure that the policies that we're recommending or advocating for do have a health equity piece. And most importantly, trying to find the underlying cause of why, why there is a gap in access to coverage. And, are there some systems, processes in place that are, what's the systemic issue of one group being able to access or just getting access, and what systems are in place that are prohibiting that for our disparate populations. But the other thing is thinking about making sure, as we are creating advocacy efforts and work groups and committees, to review policies and advocate, that we are intentional about including organizations that have lived experiences and getting, sometimes we think, oh, we know exactly what they need to do, and that's exactly what's not needed, for example, and so we want to be, the foundation wants to be intentional in reaching out and creating more robust partnerships and engagement activities with associations that represent and have the lived experience and close to the ground, who can provide us quality recommendations that can help close that gap.
Thank you. Ashley, is there anything that you want to quickly chime in and say?
I just want to briefly specifically mention our Hispanic and Latino population. Family health centers, over 25% of our patient population speaks a primary language other than English. And we know that our Hispanic population makes up less than 5% of the state population, but over 9% of COVID cases. And we've seen a lot of people that are afraid to enroll in Medicaid because of certain national policy decisions and just the national conversation over the past few years that has created an unwelcome effect. So we are working really hard with community partners and leaders in those communities to dispel some of the myths and misinformation about insurance, especially in regards to immigration status, making sure that people know that they can enroll their legally present or U.S. citizen children in Medicaid, and it's not going to hurt their immigration application or their immigration status, and that that information doesn't get sent to ICE or anything like that. So that has been a really important piece of the puzzle for us.
Well, thank you for highlighting and elevating that. And thank you to all of our panelists for taking time on this Veterans Day to discuss open enrollment, changes to Medicaid managed care, and equipping our Army of Advocates with information and resources. So I appreciate you all for taking your time and joining us. And I'm going to toss it over to my colleague, Alicia Watley, to close us out.
Thanks, Mehek. I also just want to echo what Mehek said, and a big thank you to all of our wonderful panelists this morning. Very informative from all of you. And we also want to thank Aetna Better Health of Kentucky once again for their support in making this virtual advocate forum possible today. I think we really heard about a lot of exciting changes and things coming up, such as the Connect platform, and kind of that updated platform, which is going to make it really a user-friendly way for Kentuckians to apply and access their benefits. And we also heard about the brand new SKY program that is going to be providing really comprehensive care to some of our most vulnerable children in Kentucky and also young adults. So that's a really exciting advancement that we heard about today. And I think we received really good reminders about what we can be doing as advocates. So at this time, it's so important to be paying attention to how money is being allocated in the state budget to make sure that we're prioritizing healthcare for all Kentuckians, and really beyond that, also advocating for more primary care providers that are accepting Medicaid patients and having enough of those support professionals such as the connectors and the community health workers that really provide that vital support for access and applying for benefits. And we know that these are just really going to be critical steps to make sure that we can improve the health for all Kentuckians, and especially during this time of the COVID-19 pandemic. So thank you to all of our panelists for speaking on this today. A quick look ahead for next week. We are going to be hosting another virtual forum, but we also want to point out that our Kids Count County Data Book, brand new 2020, is going to be coming out on Tuesday, November 17th. And then on Wednesday, we will be having our forum, the first of two parts to discuss that. And the theme this year for that book is the dual pandemics of COVID-19 and racial injustice affecting Kentuckians. So something exciting to look forward to next week. As always, we are going to be sending a follow-up email, and that's going to include a recording of today's forum along with all the resources discussed, which does include those slides that we saw earlier, so everyone can look back at those. And then also there will be a link to RSVP for next week's forum and for Children's Advocacy Week, which a reminder that is coming up on February 1st through 5th of 2021. So just around the corner. So thank you all for joining us today, and everyone have a great rest of your day.
Bye, everyone. Thank you.
Thank you all. We appreciate your hosting.
Absolutely.